Hi, my name is Kara Nassardi, and I'm training director at the EMDR Education and Training Center. And I'm bringing to you the third installation of our three-part series on target lists, treatment plans, and the three-pronged protocol. And the reason why I created this series is because one of the most challenging aspects facing newly trained EMDR clinicians is how to organize the information they learn in phase one of the 8-phase protocol, the history-taking phase. So to help with this, we created the three-part series to look at how to coordinate target lists, treatment plans, and then finally begin the reprocessing work with the three-pronged protocol. So the first part of this series looked at the nuts and bolts of how to create symptom-informed target lists. In part two, we examined key points in designing a treatment plan that best meets the needs of our clients. And now in part three, we're going to discuss Shapiro's three-pronged protocol and how to process past, present, and future memories within a single target list. So let's first take a little quick review of what we've done before. So as a quick recap, we began our work by learning how our clients' symptoms connect to their past experiences, present-day triggers, and future goals. And from this, we created symptom-informed target lists. And then finally, we decided on the best course of action to take by creating a treatment plan that prioritized the target list that would give the client the greatest symptom relief. And along the way, it's important to note that we also considered the client's preparation needs, and we adjusted the pace and path of our work to ensure that our client meets readiness criteria prior to beginning the work of reprocessing. So let's dive into the three-pronged protocol. So we've got our prioritized target list in hand. We now need to decide how to begin. And according to Shapiro, and this is taken from her work, Eye Movement, Desensitization, and Reprocessing, and the latest edition being 2018, while the standard EMDR procedures take place during each reprocessing session, and this is a quote from Shapiro, the standard three-pronged EMDR therapy protocol guides the overall treatment of the client. The generic division of the targets are 1. The past experiences that have set the foundation for pathology. 2. The present situation or triggers that currently stimulate a disturbance. And 3, the positive templates necessary for appropriate future action. So what Shapiro is proposing is that we work within a single target list or cluster in the following order. We begin by reprocessing disturbing memories that laid the foundation for the client's symptoms. And after we have reprocessed all of the relevant past experiences, we move on to reprocessing those present-day situations, either external events or internal cues that trigger related symptoms. And then we complete the cluster, so we finish working within that single target list by reprocessing any future experiences for which the client may hold any anticipatory anxiety. So let's start by looking at the first prong, which is the past, where it all began. And if you've ever taken one of my trainings or worked with me in consultation, you know that I'm a fan of metaphors. And in explaining to our clients why we need to start where it all began, quote unquote, I love to use the metaphor of a cut that has become infected because it has a piece of dirt stuck in it. So if the client comes to therapy with an infected cut, which in this metaphor would be a symptom, we can treat the cut with an antibiotic cream and cover it with a Band-Aid, much in the way that as therapists, we might only focus slowly on the client's symptoms. However, because there exists in this metaphor a piece of dirt, say, lodged at the core of the wound, it's never going to fully heal until we open it up and begin to clean out the dirt. And the opening up of the wound is the work we do in phase 3 assessing of the target. And then while the task of cleaning out the dirt happens in phases 4, 5, and 6, the reprocessing of a target. So I really love that metaphor of the cut and helping both therapists and client understand we got to go to the beginning. So how do we organize the past? When reprocessing past memories on a target list, one of the most efficient ways to work is with first, worst, and remaining. And so what this means is that we begin by reprocessing the earliest memory on the target list, and we do this to clear the disturbance where it originated. And once completed, we then reprocess the worst experience on the list. And the argument for doing the worst second is twofold. One, desensitizing the worst event will often have a powerful generalization effect that lowers the disturbance level of other memories on the list yet to be reprocessed. And two, by tackling the big one early on, you eliminate the elephant in the room, so to speak, and you free the client up from knowing that the worst is yet to come. So following the successful reprocessing of the worst memory, we then reprocess any remaining memories from the list that hold disturbance. And we work with these remaining memories in chronological order. So first, worst, and remaining. So by way of example, let's look at our client from the last 2 installations in this series. So if we refer back to that client from parts 1 and 2, you'll recall that that client had 2 target lists. One was clustered around a negative belief of worthlessness, and the other around a dog phobia. And we decided to work with the worthlessness cluster first because reprocessing those memories would give the client the greatest symptom relief. So we're going to work with this target list, past, present, and future, before considering other work. So, well, let's just take a quick look at this target list for the client, just to remind you of what it was. These are the childhood and then adulthood events that center around this symptom of feeling worthless, So following this first, worst, and remaining template, and you'll see here that at age 17, when dad gets drunk and gives me a black eye, that's the client's reported worst memory. So if we follow that, we would begin with the first memory was age 3, spanking in public. The worst memory was age 17, so we would do that second. Once that one was fully reprocessed, we would then do the remaining memories that hold disturbance, and it may not be all of them on the list, but the remaining memories in chronological order. And so this one, if we used all of those, this is how it would run for this particular client. We want to keep in mind, though, that things change and may change along the way. So, for example, some of these remaining memories may no longer need to be reprocessed because once we get to them, because we've worked the first and the worst, they may not hold disturbance. There also may be new memories that have surfaced and need to be added to this list in the appropriate chronological place. So for whatever the reason, bear in mind that target lists and treatment plans are not set in stone, that we're always adjusting according to the needs of the client. So that was a simplified but hopefully useful explanation of how to work the past. So now let's move on to the present. Any current triggers and disturbances that the client currently reports. And while we've taken a list of these current triggers and experiences at the beginning of treatment, we want to make sure to update this list along the way. So at the start of each session, as we check in with clients about the past week, right? This is the phase 8 reevaluation. We pay special attention to how the client's current symptoms and triggers are evolving. And by the time we get to this second prong of reprocessing the present, things may well have shifted. And this is why before we begin reprocessing present situations and triggers, we want to check in with the client to see what currently remains disturbing and modify the original list as appropriate. So once the past has been fully reprocessed, we move on to the present situations. We take a list of the current triggers and disturbances at the start of treatment, and we update the list along the way. Before we begin reprocessing, we check in. And some of the things we're going to be looking for: flashbacks, nightmares, current triggers, either external situations or internal cues that the client has, and then any avoidant behaviors that they report currently and that are current and ongoing. So let's take a look again at our example client. And here's a little list of the triggers that relate to this target list of worthlessness. So the client reports social gathering with unfamiliar people, seeing groups of teens gathering together in public, especially male, presenting at meetings, speaking to the boss one-on-one, and thinking about applying for a promotion or a job. And so to organize this list for reprocessing, we can ask the client to rank these triggers in order from the most to least disturbing or problematic. And from that, we select the most disturbing trigger and ask the client to think then of the most recent example of that disturbing situation happening. And then we target that recent experience of the trigger by using the standard protocol. So for example's sake, let's say that the second one on the list, seeing groups of teenagers in public, is the most cumbersome experience that triggers the client's symptom of anxiety. And so to begin, we just ask the client, after we've ranked them, we ask for a recent example, a recent experience from the past week when the client felt anxiety upon seeing a group of teens in public. And we listen to the client's response, and that will give us a target for reprocessing the current trigger. And for that, we just use standard protocol. So for him, teens gathering public was the worst, and we reprocess that, and then any other current triggers using standard protocol. And really for that, we just slightly modify, instead of saying past experience, we may say most recent experience. Moving on to the third prong, we have the future. And this is where we're kind of looking forward into something that hasn't yet happened. And it involves reprocessing future experiences, either planned or imagined, for which, like hypothetical of sorts, for which the client holds anticipatory anxiety. I like to think of this third prong as an EMDR dress rehearsal for achieving their goals, and the client imagining living a fuller life unencumbered from their past. And so to create a list of future targets, we draw from the client's initial therapy goals, as well as their current triggers, and any other actual or imagined future experiences that the client deems important. So if we look at a possible list of future targets for our example client, they may be something like an upcoming social gathering, being in public and presenting in front of, being in public and in the presence of a group of teenagers, presenting at a future meeting, speaking to a boss, and applying for a better job. And so to reprocess future targets, we use the standard future template, just like we do with present. And the process is almost identical to working in the past. Much like with the present, when we're working in the future, we have to just modify our language slightly during reprocessing. So we may say something like, instead of the past event, we'll change our verbiage to reflect a future event or imagined future experience. But other than that, semantic shift from past to future, the work of reprocessing future events is the same as with past. So once we've finished that third prong of future anticipatory events, we're kind of cleared for take-up, right? We've done the past, we've worked with the present and any future and events where the client holds anticipatory anxiety. Within a single target list, we can shift our focus to any other necessary tasks. So for this client, we might look at their second target list, which had to do with dog phobia. If the client doesn't have another target list, you might want to discuss the next best step with them. This could be doing more work on past events, or maybe something else has come up that they need to work on, or maybe this is a time to consider a thoughtful end to regular treatment. And whatever the answer, we collaborate with our clients to do what's best for them at any moment in time. Remembering that throughout the process, there are no right or wrong answers, right? Only possibilities. So these are some things that we might consider. And sometimes that means just appropriate termination and an invitation to come back and stay in touch whenever they need us. And speaking of which, please do stay in touch with us. We hope that you've enjoyed and benefited from this 3-part series on target list, treatment plans, and the 3-pronged protocol. If you want to take a look at these in writing, they are also part of our blog. So if you go to the EMDR Education and Training Center website, you'll see a blog link there where you can read through this and see the examples. And please do reach out. We love hearing from you. Thanks so much for your time.